Good afternoon, everyone. Welcome to this Parentune Live. And today we are talking about hMPV. I have Dr. Janardhan Reddy with me, who is a senior pediatrician and neonatologist, and he's today there to answer all our queries about this virus. So, Dr. Janardhan, welcome again. And my first query to you is hMPV the same as COVID 19?
Thank you, Nitin. Thank you for having me on this platform, especially on this occasion. So, where hMPV is making all the headlines everywhere, including television, social media, everywhere. So, this is the right time I feel to dispel all the myths and give right information. Okay, your question is COVID and hMPV are both similar or not? So, we have to understand there are certain similarities. At the same time, there are differences between COVID and this hMPV. hMPV is human metapneumovirus, and if when you come to COVID, so COVID is certain different group of virus, and this is another different group of virus. Actually, that belong to corona group of family, and this is a paramyxo group. So apart from that, what we need to know is when you come to the age group which they are affecting. So especially this hMPV is more affecting children and elderly age group and immunocompromised. When you come to COVID, that coronavirus, so that it didn't so much harm the children. So in the last three seasons of COVID, so children were the least affected. So because the whatever the receptors that are not that much developed in the lungs of children, so the coronavirus has no capacity to enter the lungs of a child. So whereas hMPV, so children are at risk group where we need to be more cautious. So whatever cases till now we have witnessed. So 2 or 3 days back in Bangalore and in Gujarat, 8 months baby, 7 months baby. These are all the cases which we got. That means children are affecting more due to hMPV rather than the COVID. And one more thing is hMPV is affecting mostly respiratory system, whereas COVID it is not just respiratory system, but systemic manifestations are there. So it is impacting heart, it is impacting other systems also. Overall other system involvement is more in COVID, but hMPV is mostly limited to respiratory system. And another difference is regarding the severity wise. So severity of COVID, as per certain studies and certain experiences. So for example, American Lung Association says that the hMPV is less severe than COVID. So we have seen the severity of COVID in last 2 or 3 years. So it was so much severe, but hMPV is not known to cause so much severe symptoms and so much fatalities may not be there in hMPV. So these are the differences between COVID-19 and hMPV.
Right. Thank you, Dr. Janardhan, for clarifying that. I think that's something which will put a lot of concerns to rest among parents. This is hMPV is not the same as COVID-19 virus. Dr. Janardhan, is this a mutation of an existing virus, or is this something which is new? And why is it being called a mystery virus? What is the mystery behind this virus?
So see, actually the human metapneumovirus, which we are calling hMPV. So frankly speaking, this is not a new virus. So we have seen, most of the people are thinking that from China, it just getting into India or into the world. So, but the thing is, so the virus has been there since 2001. So officially it has been isolated in Netherlands in 2001. But study says that, so since 1950s and 1960s, in the middle of the 20th century itself, the virus has been there and the cases has been there in our hospitals also, the hMPV virus, these things. So I will say that this is not a new virus, but as you said, regarding mutations and all, yes, all viruses are prone to mutations. So, for example, take influenza virus and all. So, it goes on mutating almost every year. So that's why the influenza vaccine and all, which we take annually or 6 monthly. So every year it should have the combination of the newest strains that are there in the community. So yes, there is a possibility, we can say, but till now the research is ongoing. So at this point of time, I think it will be too naive to comment on that. As the virus is not a new one, but the possibility of strains and all, mutations and all can be there, which ongoing research is there. We'll get answers in time.
Right. Why is there an incubation period as long as 3 to 6 days in hMPV? And what does this incubation period mean, especially for the child or someone else? Can someone else get it?
Yeah, see, the incubation period means, so once you got exposed to the virus, the time period between the exposure to the virus and manifestation of the symptom in the subject. So this is the period which we call as incubation period. So from the time you expose to the virus and then you get the symptoms, this is the time period which we call incubation period. So for hMPV, the incubation period is around 1 week, or you can say 3 to 6 days. So during the incubation period, whether if any other person get interaction with this particular person who is in the incubation period, will they get the symptoms? See, this is a see, for this, to for better understanding, you need to understand the spread of the hMPV. So how the hMPV will spread? Through the droplets, when you are coughing, when you are sneezing and all. So during incubation period also, the virus will be in your body. So at that time, if any contamination happens from one person to another, there is a possibility that the other person will also get. So during incubation period also, we may not be knowing that we are the carrier of the virus. So this is the period where we need to be very much careful. If you have a child at your home, then you need to maintain certain precautions so that you may not spread the virus which unknowingly you are harboring to your child or to your family members. Yes, there is a possibility, Nitin.
Right. So what you've actually educated us about is, and this is really helpful, Dr. Janardhan, that even if the virus is in the incubation stage, a child can get that infection. Is that right, Dr. Janardhan?
Yes, Nitin. So there is a
And in
possibility. Yeah.
and there's a possibility. My question to you is, how does one know if someone is carrying the virus? Like, are there any symptoms? Because my understanding is the symptoms may not show in the incubation period. Is that right?
Yes, yes, exactly. So the incubation period is the, see, the understanding of incubation period itself is the time period between you got exposed to the virus and you are manifesting the symptoms. That means during that period you may not be showing the symptoms, but there are certain diseases and so many diseases where incubation period is also a period where the infection occurs, because you will be having the virus, but the capacity to spread the virus may be minimal, because when you cough, when you sneeze, only the virus will get out. So during that period, the capacity to infect others will be more. But even during the incubation period, since you are harboring the virus, so there is a chance that the virus may get transmitted, by the secretions, by using same objects, by towels or certain things, by handling the things and all. So there is a possibility that it will spread. So, but you have to understand that the difference between incubation period and symptomatic period. During symptomatic period, it is very obvious. You cough or sneeze out, you will be transmitting larger load of viruses. But during incubation period, the load may be less, comparatively lesser. So that's the difference. So, but you need to be, cautious during all the period.
Okay. Now, this is interesting, Dr. Janardhan, and this is perhaps something which I would like to ask you more, because parents would be very keen to know that if I am the carrier, but I don't know about it because the virus is still in the incubation period, what are the kind of precautions I need to take? And like you said, then for now, till the time the virus is in the air, parents should actually assume that they could be a carrier and they need to take those precautions. So is that the right understanding of this, Dr. Janardhan?
Yes. See, the thing is, the situations of public health concern, like the COVID pandemic which we had, and the hMPV concern which we may have. So these are the things where, see, COVID, most of us got COVID, but only some of us has manifested symptoms. So that itself says that COVID would have spread from other person who may not have shown any symptoms. Similar thing here. So whenever there is a public health concern is there, everyone has to follow preventive measures. So that's the only way to stop the spread of that particular virus. So from assuming the epidemic or pandemic potential, the public health authorities will issue the guidelines or directions which everyone has to follow. So that's the only way to stop the spread of the virus. So for this, certain preventive measures are there, like using a mask, hand washing, using sanitizer, maintaining social distancing, so avoiding public places and all, crowds and all, and cleaning the contaminated surfaces. So commonly used objects like doorknobs, toys, tables, chairs, and all. These have to be kept clean. These are basic things which, if we follow, we can spread. We can stop the spread of this virus during these times. So that's what I would like to say.
Right. Another question I had in line with this, Dr. Reddy, is that even from whatever you've said, this could be a common cold also for an adult, right? And
Exactly.
uh, and let's say if it is like a common cold as an adult, when I go back home, should I then follow all these precautions as well, or it's just common cold, so I don't need to worry about it? My the child at the home would not get it. Is that the correct understanding, or the other way around?
Exactly. We have to follow all the precautions. Actually, see, what people would say, many doctors and all, many scientists. So they, during COVID pandemic itself, they advised wearing mask at public places at any point of time, not just during pandemic times, or not just during now. We assume that last 2 years are normal. After COVID we can remove the mask and all, but as a general advisory, so most of the doctors and scientists advise that when you go in public, please wear a mask. So whether you have symptoms, whether there is a pandemic or not, that we should be doing. And your question is like, you got a cold and you came home, what should we do? We should have the mask and all the preventive measures. Yes, definitely. If you are having a cold, definitely there is a chance that you'll be spreading the virus whichever you have to other family members. So definitely you have to wear mask, and you have to follow all the measures which I had told.
Right. Another, contra view which I would like to share with you, which has now started coming up. A lot of people are talking about it. A very senior professor from AIMS has said that there is no reason to be worried about hMPV because this virus has been around since 1970, and we don't need to panic at all. Nothing will happen. What do you think about that, Dr. Janardhan?
So actually, to certain point, what I would say, this is my understanding, I would say that yes, definitely, for any virus, that public feels is a cause of concern. I say that there should be a an element of caution should be there. So that doesn't mean that you get scared the people, scare the parents and all. So I don't say that, but you have to be careful. Caution has to be maintained, whether it is a new virus or a old virus. So because it is going to affect the health of the people, and if it is affecting the health of the people at larger scale, then definitely it is a burden on whole public health infrastructure. So then that will become so whenever the health facilities and all are compromised or overburdened, then it will definitely become a cause of concern, even though it is a common flu, even though it goes in a milder way. So when it is affecting at a scale, at a larger scale, so then I feel that it will become a cause of concern. So what I say, I don't really care whether it is a new virus or old virus or a different strain and all. So if it is affecting our health, if it is coming to our home, then we need to be educated, we need to be cautious, and what are all within our capacity we should do. So, and there is no need of unnecessary fear and panic at all. So but
Right.
we should be careful and cautious, that I can say.
Right. I have the first few questions, Dr. Janardhan, and I'll come back to asking you some more questions. But the first few questions are: first, is fever a sign of hMPV? Priyanka has asked this question. Uh, how do you differentiate between normal fever and a fever which is because of hMPV?
See, hMPV is mostly a respiratory virus, so that means it will be affecting our lungs. So fever can be hMPV. So fever associated with cough, cold. Usually cough, cold, fever, wheezing, the sounds which we get in our chest. So these are all the things which point us towards a respiratory symptom. So when your fever is associated with cough, cold, and then the wheezing, and then some form of breathlessness and all, so then we can suspect that there is something going on in our lungs. Okay, so whether it is hMPV or not, so basically by looking at symptoms, no one will say this is looking like hMPV. We can say given the times. Okay, so during this period, if most people are getting affected from that, so then we can say that there is a possibility looking at the symptoms. But confirmation and all will come at the next level. So only when we get our investigations done, then only we can say that that is hMPV. Even before that, we can never say that. So possibility that that may look like a respiratory virus, and possibly this can be this. So this is the probable diagnosis we can give, but the final diagnosis and the confirmatory diagnosis will come only after doing all the necessary examination and investigations.
Right, right. Thanks, Dr. Janardhan. Another question is from Shaima, and Shaima has asked whether she could consider just a cold and look at it, and how can she look at that common cold and say, okay, this looks like hMPV. So, what would be your advice for Shaima?
Hi, Simon. So see, by just looking at cold or cough, or for that matter, fever or anything, you can never say that it is hMPV. Okay. So the thing is, cold, cough, fever, these are symptoms. These are actually manifestations of some other thing going on in our body. So that can be due to anything, not just hMPV. So it can be another flu or another something. So by seeing at the symptom like cold, cough, or fever, you can never say that it is hMPV. But yes, is the possibility is there? Yes, it can be there. But is it definitely hMPV? That we cannot say.
Right. Thank you, Dr. Reddy. Now, related to this, there are several questions, and I'm clubbing them from parents.
Yeah.
But just asking one question before that: why is hMPV affecting children more than adults? Is there a reason, Dr. Janardhan?
Yeah, actually, see, any virus, for that matter, any microorganism, for that we have to understand the basics of our immunity or physiology, which goes on in our body. So what happens is whenever certain external organism, or we can call it an antigen, comes into our body, it enters our body. So there is a defenses within our body that's called immune system. Immunity will be there. So whenever there is certain uh, microorganism or antigen entering our body, our defenses will start fighting it. Okay, so the interaction between antigen and antibody, it depends on the strength of antigen and strength of antibody. So if the strength of antigen is more, then it will defeat the antibody and the disease will occur. If the strength of antibody is more and antigen is less, then our body will win over the microbe and we will not be affected with the disease. So this is general understanding, the simpler understanding. So what happens? So for any virus or for any microorganism, their obstacle is our immune system. Whenever the immune system is weaker or immature or defective, then it will become very easy for the enemy or the microbe to enter our body and affect our body with the disease. So this is the basic understanding. And see, for example, hMPV. You take hMPV. So whom this is affecting more means the at-risk groups are children, elderly, and immunocompromised. So when you take children and then the elderly, so for them for children immune system may not be so much mature. So you have seen 7-month-old, 8-month-old getting affected, and the elderly. So they may be having chronic diseases and all. And the immunocompromised, their immune system itself is not complete or defective. So if you put this in our in our understanding, that means the antibody system is weaker when compared to antigen system in these risk groups. So what happens? It is the possibility of getting disease is more in these age groups, in these risk groups. So that's why we can say that children are getting more affected. And you
Right.
can the extension question you can ask, why COVID hasn't affected children more? So same thing applies, but what happens is the COVID virus, it needs the receptor in the lungs for it to first come and attack. The epithelium have a receptor. So COVID virus has to come and stand on that, then only it enters the lungs. So fortunately, the lungs of children are not so mature to have that receptor. So that's why COVID virus couldn't affect the children. So only certain children affected, that too to a milder extent. So that's the reason why COVID couldn't, impact children more, more severely. So this is
That's a great insight. Yeah, that's a great insight, Dr. Reddy. But you were talking about immunocompromise and risk groups. Can
yes.
you can you talk a little and elaborate about what are immunocompromised conditions or these ailments in children? And can you tell us, is asthma, for example, or bronchitis, uh, in an immunocompromised group when it comes to a child? And what are some of these others?
Yeah, actually, if we come to immunocompromised state of a children, so this immunodeficiency will say, so it is of two types, broadly two categories: primary immunodeficiency and secondary immunodeficiency we call it. So primary immunodeficiency means what happens is the immune cells which we had, they will be deficient. So I don't want to go much deeper here. So the immune cells are like the white blood cells, lymphocytes, macrophages. These are the things. So these cells themselves will be defective either functionally or structurally. That is primary immunodeficiency. There will be many conditions where neutrophils are deficient, phagocytes are deficient. So those conditions are called primary immunodeficiency disorders. And then comes the secondary immunodeficiency. Secondary immunodeficiency means the children is all right by birth. I mean, he has all the immune system cells and all. But secondary immunodeficiency means after, you know, after birth, during the growing period and all, he got affected with certain conditions so that the immune system will become dysfunctional. For example, AIDS, HIV/AIDS, acquired immunodeficiency. So this is an example of immunodeficiency. And there are certain other disorders which comes under this secondary immunodeficiency thing. So even parvovirus disorder. So these are certain things where the immune cells will get affected, and then immunodeficiency will occur. Even certain leukemias, lymphomas, these are all comes under these immunocompromised conditions. So in such groups, since our immune system itself inherently is weak, there is more chance that hMPV will affect these children.
Right. Riddhi has asked a question, Dr. Janardhan. Her child has asthma, and she's asking, is she under threat?
Actually, if there is certain underlying lung condition, so they are more prone. I mean, if you compare a normal child to a child having asthma, so who are going to suffer more? So it's very simple. if the child is already having a lung condition, you need to be more careful. So because when the virus is affecting a normal lung or already compromised lung, so it's so simple as that. So already compromised lung will get suffered even more. So yes, if your child is having asthma and all, you need to take more precautions because the child will be, severity will be a little more when compared to a normal child. So you need to take immediate medical care if the child is showing symptoms and all. Nitin.
Right. So, Dr. Janardhan, now coming to newborns, right? And there are some questions. Uh, how do you know in a newborn that a newborn has got hMPV? Let's say the child has just been born and the birthing has happened. Um, how can how can you know is one part. Second is what are the kind of precautions which you need to take while birthing? So if you can talk a little about that, I think that would be really great.
Yeah, actually, see, at birth, if a child or a baby, newborn baby, is having hMPV or not. So, see, first, further, we have to see the mode of transmission. So, mode of transmission means for a newborn baby, the baby won't be exposed to the outer environment. It will be exposed, the baby was in womb itself and it came out. So, if the baby is having hMPV or not, so there is only one mode of transmission, that it should come from mother to the child. One thing. So that means within the womb, that is called intrapartum transmission. So within the womb, it should have transmitted from mother to the child. Or second thing, during the delivery, the process of delivery. That means whether it is cesarean section or normal delivery, or whatever kind of delivery. So at that time, it got exposed to the outer environment, and at that time, it should have get exposed to the virus. So these are the things which we need to keep in our mind when we are suspecting a newborn of hMPV. So either intrapartum route transmission or during the delivery. So during the delivery, when it exposed to the environment, it may have affected. We have seen the similar things in the COVID. So COVID also got transmitted intrapartumly. So when the mother is having COVID, so there are certain cases reported where COVID got transmitted intrapartumly to the newborn baby. And then within the delivery room atmosphere is also very much important, where the delivery room, if the precautions are not followed, so there is a possibility that the baby gets exposed from outside environment. So these are things which we should be aware about this. But I think till now hMPV intrapartum route, so during this period hasn't been reported to my knowledge.
Right.
Yeah.
Right. But also from a birthing point of view, when you're bringing the baby back home, what are some of the precautions you need to take care of, Dr. Janardhan?
Yeah. So we'll talk from within the hospital. So the baby got delivered. So then what happens is, out of interest and happiness, many people come to visit the baby. So our intervention should start from there. So you should decrease the interaction of baby to number of people. So other than mother and father or one more attender, we should not allow more attenders to touch the baby, to see the baby, to interact with the baby. So because this period is very much important, where the baby should should not get exposed to the viral atmosphere. So whenever you are handling the baby, please wash your hands with sanitizer and then touch. And even during breastfeeding, please wash your hands and then only go for breastfeeding or bottle feeding. And then if mother is having hMPV or symptoms, then use a mask while breastfeeding. Then hand washing is must. And then avoid exposure of the baby to outsiders as much as possible. And then if you are suspecting symptoms, like the newborn baby may not cough out like an adult or some other people, so any dull activity of the baby, so that should arouse the suspicion that the baby is not well, the baby is not feeding well, the baby is dull. So these are the symptoms where a newborn can be suspected to have something. I'm not saying hMPV, but any disease or any illness in the baby will be manifested like this only. A newborn baby, the
Right.
baby will be done. We will not be feeding. So then you should have, you should seek immediate medical help. So regarding
Right.
what is happening.
Right.
Yes.
Thank you, Dr. Reddy. So just, while we were talking about hMPV, we are taking questions from parents on Parentune, from our social handle. I just want to reiterate that today we are talking about hMPV. Dr. Janardhan has given a lowdown on what is the virus, how does it spread, right from a newborn and pregnancy stage to a later age of a toddler. And now we are going to take more questions, and so you can feel free to ask your questions right now. Also, we have another 10 to 15 minutes to take your questions. Another question which has come in from a parent, Dr. Janardhan, is that, is weather going to play a significant role in the spread of this virus? Is it just another 25, 30 days that they need to be like really overtly cautious? And in line with that, a parent has asked, should I stop letting my child go outside the house?
Yeah, actually, the thing is whether is playing a role in spread of the virus or not. I'll answer this one. So yes, weather has a role because all the flu viruses, so they have a tendency to spread during winter and early spring. Yes, this is the exactly the same season where we are witnessing increased respiratory cases. So yes, the cold weather and the damp atmosphere and all, they definitely play a role in spreading the virus. And then the second question is, should we stop our child from going out? So I think this I advise you need not stop the child from going out, but be careful, take precautions while you are sending your child out. So I'll definitely say that don't you should not send your child to a crowd. I mean a procession. So where so many people will be coming and all, but you can send your child to the playground, you can send your child to the school, but where you should take precautions like minimal precautions like wearing a mask, sanitizer, maintaining distance, hygiene and sanitation practices. As long as you are doing these things, then we can keep our child safe. I can't hear voice, Nitin.
Sorry, Dr. Reddy. Is this safe to say that this is especially like a bigger precaution situation for cities where we already have cases, or should we practice that in cities which haven't yet reported any cases, Dr. Jananda?
So actually the thing is, we already are well equipped with handling this kind of situation because since 2020 we have seen COVID pandemic in three waves and everyone is well equipped. I mean, there's no need of special preparation and all. Only thing is they should have the will to follow the precautions and all. So I think uh, rather than saying like government imposed restrictions and all, I think it will be very much helpful when we ourselves start following these precautions. These are very simple but very effective things. So there's no need of any government functionary coming and imposing the restrictions and all. Rather than that, if we start following simple things, then it will definitely help. So this will help in reducing the number of cases, reducing the spread. So yes, we should follow
Right,
to certain extent, but
right.
not limiting the activity entirely. That I won't say.
Hmm. So play is also equally important for the child, going out in the open and
Exactly,
playing.
exactly. Yes, exactly. So you don't
Right,
send you to a crowd or a procession and all. So just you can send to the playground, play area. So that we can do,
right,
but follow the precautions. That's it.
right, right. Is hMPV more dangerous for children with existing health conditions, especially like asthma or Let's say if a child gets cold and cough frequently, and let's say their immunity is not really up there, right? Would you say those children are, they need to take more precautions, parents need to take extra precautions for those children? And then I would also like to ask you, what are some of those precautions, especially for children with these kind of conditions or weakened immunity?
Yeah. Yes, definitely. As we already said, these are the conditions where the child will be, getting the possibility of more severe disease will be there in such conditions, where asthma, bronchitis, or any other underlying condition, if the child is having, yes, the particular child has to take precautions, more than other children. So, like if the child is having asthmatic, he should have his asthma medication in his school bag or wherever he goes. He or his guardian or parent should carry the medication, and he should be following all the precautions as we described. And these children should be extra cautious. So, as I would advise a normal child to go out for play, maybe these children, these are the children who are at risk. So, they should be, a little more cautious than other children, since they are, the possibility of more severe disease is there. So as a parent, we should be more careful and, extra cautious regarding this children whenever a symptom is there. So that is the step where we should seek immediate medical attention and then resolve it as soon as possible.
Right. Dr. Janardhan, there's a question from Akansha who's asked that, is a lockdown hitting anytime soon?
Akanksha, regarding lockdown and all, so I can't comment whether it is coming or not. But what I can say is, so lockdown is a thing when we already witnessed during COVID period. So when there is number of the cases are increasing enormously, exponentially. So at that time, to prevent the spread of the virus, government resort to a measure known as lockdown. I think since COVID was the first time hitting the virus, hitting the world, not just India. So at that time, there was no, no preparation and all. So lockdown was the only solution to, contain the spread. So my personal feeling is, as the hMPV, no severe cases have been reported till now, and the studies are also saying that hMPV may not be that much severe, and the spread virality, we call it, the spread potential of hMPV is also, I think, lesser than COVID-19. So, taking all these things in our mind, so I don't think lockdown can be there, but I can't comment it. We can never guess what happens tomorrow.
Right. I mean, from what is being reported by China, there have been severe breakouts in a few cities, and the hospitals have been jam packed. And if that kind of a situation was to happen, Dr. Janardhan, nobody knows, right? What are the kind of precautions we need to take, right? But as of now, like you said, we are not staring as of now that kind of a situation.
Exactly, exactly. So that's what I want to say. So see, if the word lockdown is spreading virally, in the social media and all, people feel that, there is some kind of COVID kind of severe virus is coming and all. Government
Hmm.
is going to shut down everything and all. So
Hmm.
that will, spread unnecessary fear within the communities and all. But I don't. This is my personal opinion. There can be any contrary thing happening tomorrow, but I personally feel that, taking into account the severity of the virus, the virality of this virus, and the preparedness which we already had. So we already, the people's behavior is already, acclimatized to the things which we should be doing during a pandemic. And then the health infrastructure is also heightened after the COVID pandemic. And the health personnel also, they are well equipped and well skilled to handle these things. So I think, keeping in mind all these points, so maybe I don't think there is a possibility of lockdown, but I will not rule out the same.
Right. There are two more questions, Dr. Janardhan. One is from Akansha. She has asked a follow-up question. She's asked that how can she go on to improve her child's immunity levels given the current situation? And Akansha, that's a great question. Dr. Janardhan, what would you advise parents in order to improve their child's immunity levels right now?
Actually, this is very commonly asked question, not just here, but many mothers and fathers in the OPD, in the hospitals, they will be continuously asking, like, sir, what we have to do to improve our, children's immunity and all. So the thing is, we have uh, uh, one thing we have to do is, first thing, the diet which we are taking. So we should be giving them the protein rich diet. So cut down all the unnecessary fats or processed foods, these beverages, sugared beverages and all. If there is any, have the child is habituated to these, sweetened beverages, fast foods, junk foods and all. Cut down them so that the child eats at home healthy food, protein rich food. So this diet wise, this thing we have to do. And then the second thing is physical exercise. Physical activity is very important for every children. So these are the days where we see the cases of obesity. So people are eating junk food, not doing any physical activity, and are getting obese. So this thing we have to do. So first thing is diet, second thing is physical activity, and third thing is timely immunization. So immunization, the vaccinations are there. So you have to follow either national immunization schedule or the IAP immunization schedule. So you have to give these things, provide them with you know uh, proper diet plan, exercise plan, and then follow the medical advice whenever
Right.
needed. Give them
Right.
time. These are the simple things which we
Thanks,
can do.
Dr. Thank you. Dr. Reddy, another question which I had, which is a follow-up, is is there a immunization for HMPV?
No. So till now, there is no vaccination that is catering to hMPV. So maybe the research is ongoing and it may take time to get vaccination for hMPV. So soon we may expect that we will get hMPV vaccine.
And this is globally true, Dr. Janardhan, or is that India doesn't have immunization for HMPV?
It's globally true. So I think, to my knowledge, there is no vaccination for hMPV. So as the see, we also never had any vaccination for COVID. So since the cases were increasing and the research efforts stepped up and we got vaccine. So same thing can happen in case of hMPV as well.
Right. Then it becomes even more important, perhaps, to have the precautions in place, especially because of the way this is affecting children. So, what are those precautions parents need to take to keep their child safe and protected from HMPV, Dr. Janardhan?
Yeah, this is very important thing which we should do. So first thing is the coming is festival season for especially South Indian people. So I would prefer them not to, send the children to, outside destinations and gatherings, big functions and all. Okay, first thing that you can do. Second thing is, whenever you are going out, have a mask, put on a mask. Second thing is, use sanitizer, regular hand washing. Third thing is, so maintaining social distancing and all. Fourth thing is, everyone in your house also or in any other place, the objects, publicly used objects like doorknobs, chairs, tables. So these things should be clean enough, and the surface cleaning should also be done whenever, as frequently as possible. And then at the point of, whenever you know that you are getting symptoms or your child is getting symptoms, seek immediate medical attention. That will help you. So rather than delaying and going to the counter and getting medicine and all, so take a proper medical advice that will help you, save your child or protect your child from getting infected with hMPV. So these are the precautions, Nitin.
Right. The big one which I am taking away from this, Dr. Reddy, is avoiding to go with the child or the baby to crowded places. I think that's a big one which you're sharing. Um,
Exactly.
and the
I'm saying
rest,
this is the festival season for South Indian people.
yes,
So in
absolutely.
Pongal, yeah,
Yeah. And
as
also
we,
in the north of India, there is Lori coming up, Dr. Reddy. So I think these are places where there could be a large crowd, and that is what you're highlighting, that we can avoid taking children there.
moreover, the Mahakumbh Mela is there in Prayagraj, which is
Yeah.
starting February 13th, I think.
Yes.
So
Yes.
this is also, we need to be more cautious at this point of time.
Hmm.
So
Right.
those large gatherings, I think that Prayagraj will get crowds of people.
Right.
So
Absolutely.
yeah,
No, this is great and really helpful. And thank you for clarifying all these concerns, addressing all these questions from parents today, Dr. Reddy. I think it has been really useful. I think parents would have not only taken precautions away from this live, but also would have gotten to understand what is HMPV, why does it affect children, what are the kind of things to be kept in mind, also what is an incubation period for this virus, why do parents need to be overtly cautious, because for all we know that adults could be in that incubation period for the virus and it could be affecting a child. So we have to de facto take that into consideration, and the kind of precautions you suggested today. I think this has been really great, Dr. Reddy. As always, a pleasure hosting you, asking you questions today. Thank you for your time. And for parents, if you have a few messages before we close this live, it would be great to hear from you.
yeah. Thank you, Nitin. So I think after all the discussion, and we can say that. So there is no point that we need to go out and shout that there is hMPV and all. No need to panic and all. So I personally feel, and many of my colleagues feel, that hMPV is there. It's a reality, but small steps, being careful, being following preventive measures, following the things which we already learned during COVID pandemic. So these are the things which help us, and will definitely move over. We can easily win over hMPV, as we had experiences from the COVID pandemic, and we will be following the preventive measures, and with all the support from government functionaries or public or private health infrastructure which we built over last few years and all. I think this is not a very big obstacle which we should fear. We should not be afraid of that, but be cautious, be careful. We can definitely win over hMPV.
Thank you, Dr. Janardhan. With that, we will end this workshop. To all the parents, please, in case you've missed this workshop or joined from between, make sure that you go on Parentune and watch this whole workshop. And this will help you understand hMPV really in detail and will help you protect your child from hMPV. Please take care, everyone. And thank you again, Dr. Reddy.
Thank you, Nitin. Thank you so much.